My name is Ejiro Pekulia Oyowe from the Manual Osteopathic College of Canada. I will be presenting my hypothesis-based case study titled Correction of Pelvic Dysfunction using Osteoarticulation Techniques to Improve Gait Mechanics and Reduce Mechanical Low Back Pain. Abstract. Mechanical low back pain is one of the most common musculoskeletal conditions encountered in clinical practice and may significantly reduce functional mobility, independence, and quality of life. In this hypothesis-based case study, I investigated whether correcting pelvic dysfunction using osteoarticulation techniques could improve gait mechanics, restore normal movement, and reduce mechanical low back pain in an adult participant. The title of this case study is Correction of Pelvic Dysfunction using Osteoarticulation Technique to Improve Gait Mechanics and Reduce Mechanical Low Back Pain. The hypothesis proposed that clients presenting with pelvic dysfunction and mechanical low back pain would experience improved gait mechanics, decreased pain, and better functional mobility following osteoarticulation treatment directed at correcting pelvic and lumbar dysfunction. This case study includes an abstract, introduction, methods, results, discussion, conclusion, and bibliography. The participant presented with mechanical lower back pain associated with pelvic dysfunction and difficulty with prolonged standing, sitting, and walking. A comprehensive health history interview, global osteopathic assessment, gait assessment, postural assessment, Mitchell testing in standing, seated, supine, and prone positions, and a structural osteopathic examination were completed. Special tests include the straight leg raise test and Fable test were performed where appropriate to assist clinical reasoning. Treatment consistent of general osteopathic techniques, muscle energy techniques, strain counter strain, pelvic and sacral correction, sacral joint correction, lumbar spine correction, and other osteoarticulation techniques based on the identified somatic dysfunction. Reassessment was completed following treatment to evaluate changes in pain, pelvic alignment, gait mechanics, lumbar mobility, and overall functional movement. Following treatment, the participant demonstrated clinical meaningful improvement in pain intensity, pelvic alignment, lumbar mobility, gait mechanics, and tolerance to functional activities. The findings supported the proposed hypothesis that correcting the pelvic dysfunction using osteoarticulation techniques may improve biomechanical function and reduce symptoms associated with mechanical low back pain. And in conclusion, this case study suggests that osteoarticulation technique may be an effective conservative treatment appropriate for clients presenting with mechanical lower back pain associated with pelvic dysfunction. Although positive clinical outcomes were observed, further research involving larger sample size is recommended to strengthen the evidence supporting the effectiveness of osteoarticulation techniques in the management of mechanical lower back pain. Methods. An adult client presented with mechanical lower back pain that has been aggravated by prolonged sitting and daily activities. A completed osteopathic assessment was completed before treatment to identify the primary areas of dysfunction. The assessment includes postural observation, gait analysis, active and passive lumbar range of motion, palpation, standing and seated flexion tests, leg length assessment, sacroiliac assessment, lumbar segmental motion testing, and evaluation of the pelvic alignment. Findings suggested somatic dysfunction involving the pelvis, sacroiliac joint, and the lumbar spine. Based on the assessment findings, an individualized osteoarticulation treatment plan was developed. Treatment was provided over multiple sections, with each appointment lasting approximately 45 to 60 minutes. Reassessment was completed before and after treatment to monitor changes in pain, joint mobility, and functional movement. Treatment focuses on restoring normal joint mechanism using osteoarticulation techniques. The pelvic was treated first to improve overall biomechanical balance, followed by the sacroiliac joint and the lumbar spine. Appropriate mobilization and articulatory techniques were applied according to the identified dysfunction while respecting the client's comfort and tissue tolerance. Treatment progressed from global assessment to regional treatment and finally to the specific dysfunctional joint. The client also received education regarding posture, body mechanics, activities modification, and a home care program that include gentle mobility exercise and stretching. Home care instructions were reinforced at each visit to encourage active participants in recovery and reduce the likelihood of symptoms recurrence. Following each treatment section, reassessment was performed using the same objective measures completed during the initial examination. Changes in pain intensity, lumbar range of motion, pelvic alignment, joint mobility, tissue tension, and functional activities were documented to evaluate the effectiveness of treatment and determine whether the hypothesis was supported. Results. The result of this case study supported the proposed hypothesis that osteoarticulation techniques may improve joint mobility, reduce pain, and enhance functional movement in a client with mechanical low back pain. Before treatment, the assessment identified somatic dysfunction involving the pelvis, the sacroiliac joints, and the lumbar spine. The client demonstrated reduced lumbar range of motion, pelvic asymmetry, tenderness over the affected joints, and pain during prolonged sitting and movement. Functional assessment also showed restricted movement and difficulty maintaining normal posture. Following osteoarticulation treatment, reassessment demonstrated improvement in joint mobility and pelvic alignment. Lumbar movement became smoother with less restriction and tenderness over the involved joint was reduced. Functional movement, including bending and walking, were completed with greater ease compared to the initial assessment. The client also reported a reduction in low back pain and an improvement in overall comfort during daily activities. Prolonged sitting was better tolerated and movement felt easier after treatment. Overall, both the objective assessment findings and the client's subjective feedback demonstrated positive clinical changes following treatment. These findings supported the hypothesis that osteoarticulation techniques may improve joint mechanics, reduce pain, and enhance functional performance in individuals presenting with mechanical low back pain. Discussion. This case study was carried out to determine whether osteoarticulation techniques could improve joint mobility, reduce pain, and improve function in an adult client who is presenting with mechanical low back pain associated with pelvic and lumbar somatic dysfunction. Based on the assessment and reassessment findings, the results supported the proposed hypothesis. Following treatment, improvements were observed in the pelvic alignment, lumbar mobility, functional movement, and pain level. These findings suggest that restoring normal joint mechanics may positively influence the client's symptoms and overall movement. One of the most important findings in this case study was the improvement in joint mobility following treatment. Before treatment, the client demonstrated restricted movement within the pelvic and lumbar spine, together with tenderness and pain during movement. These findings are commonly associated with mechanical low back pain and may alter normal body mechanics. After osteoarticulation treatment, reassessment demonstrated smoother joint movement, improved pelvic alignment, and less restriction during functional activities. These changes indicate that restoring physiological joint motion may reduce abnormal stress placed on surrounding muscles, ligaments, and fascia. Another important outcome was the reduction in client's pain. Pain is often one of the main reasons individuals seek osteopathic treatment, and even a small reduction may significantly improve the quality of life. Following treatment, The client reported less discomfort during walking, standing, and prolonged sitting. Although pain is a subjective finding and varies between individuals, the client's report was supported by objective improvement observed during reassessment. This suggests that the treatment produced both measurable clinical changes and meaningful improvement from the client's perspective. Improved function was also observed following treatment. Before treatment, the client experienced difficulty with movements involving the lumbar spine and the pelvis. After treatment, movement became easier and less restricted. Functional improvement is an important treatment outcome because the main goal of the osteopathic care is not only to reduce pain, but also to restore efficient movement and improve participation in daily activities. Improved joint mechanics may also reduce unnecessary muscle guarding and allow the body to move more efficiently. Although the findings of this case study were positive, several limitations should be considered. This study involved only one client and one clinical case. Therefore, the findings cannot be generalized to the wider population. In addition, the client was reassessed immediately after treatment, meaning that only the short-term effect of osteoarticulation were evaluated. Long-term improvement was not measured, and other contributing factors such as exercise, daily activities, stress, and compliance with home care recommendations may also have influenced the outcome. Another limitation is that manual osteopathic assessment depends greatly on the clinical palpation skills and clinical reasoning. Different practitioners may identify slightly different dysfunction or apply different treatment techniques while still achieving positive outcomes. And for this reason, continued practice, mentorship, and clinical experience remain important in developing consistency and accuracy in osteopathic assessment. The client was advised to continue with the prescribed home care program, including gentle mobility exercise, postural correction, regular walking, and avoiding prolonged sitting without movement breaks. Maintaining good hydration, remaining physically active, and following ergonomics advice may also help reduce the recurrence of symptoms. Follow-up treatment sections would allow continued monitoring of progress and provide the opportunity to address any remaining dysfunction identified during reassessment. This case study also highlighted the importance of working collaboratively with other healthcare professionals. If the client's symptoms persist, worsen, or fail to respond to conservative management, referral to family physician or another appropriate healthcare provider should be considered. Collaboration with physiotherapists, massage therapists, chiropractors, or exercise specialists may further support rehabilitation and improve long-term outcomes. From the client's perspective, the treatment resulted in reduced pain, improved joint mobility, better functional movement, and increased confidence during daily activities. This improvement may contribute to better work performance, greater independence, and an overall improvement in quality of life. From the therapist's perspective, this case study strengthens clinical reasoning, improves confidence in identifying pelvic and lumbar somatic dysfunction, and reinforces the importance of completing a thorough assessment before selecting an appropriate treatment technique. It also emphasizes the value of reassessment in determining whether treatment goals have been achieved and whether the original hypothesis has been supported. From a cost-benefit perspective, osteoarticulation provides a conservative, non-invasive treatment option that may reduce pain and improve function without the need for medication or surgery in appropriate cases. For many clients, this may reduce healthcare costs, minimize time away from work, and encourage active participation in recovery through education and home care strategies. Future studies should include larger sample size, multiple treatment sections, and longer follow-up periods to determine whether the improvement observed in this case can be maintained over time. Future research may also compare osteoarticulation with other manual therapy approaches to better understand its effectiveness in managing mechanical lower back pain. Overall, this case study supports the use of osteoarticulation as part of a comprehensive osteopathic treatment plan for clients presenting with mechanical lower back pain. Although additional research is needed, the findings suggest that restoring normal joint mechanics may contribute to reduced pain, improved movement, and better functional outcomes. Conclusion: this hypothesis based case study investigated the effectiveness of osteoarticulation technique in the management of mechanical lower back pain that is associated with pelvic and lumbar somatic dysfunction. The purpose of the study was to determine whether restoring normal joint mechanics would improve joint mobility, reduce pain, and enhance functional movement. A comprehensive osteopathic assessment was completed before treatment to identify the primary area of dysfunction. Based on the assessment findings, appropriate osteoarticulation techniques were applied and the client was reassessed immediately after treatment using the same assessment procedure. The reassessment demonstrated improvement in pelvic alignment, lumbar joint mobility, functional movement, and pain level. These findings supported the proposed hypothesis that osteoarticulation techniques may contribute to improved biomechanics and reduce symptoms in clients presenting with mechanical low back pain. Although this case study demonstrated positive clinical outcomes, it represents only one client and cannot be generalized to all individuals with mechanical low back pain. Further studies involving larger sample size, additional treatment sections, and long-term follow-up are recommended to provide stronger evidence regarding the effectiveness of osteoarticulation techniques. This case study has strengthened the understanding of osteoarticulation as an important component of manual osteopathic therapy. It has also reinforced the importance of completing a thorough assessment, developing a hypothesis-driven treatment plan, performing reassessment after treatment, and using clinical reasoning to guide patient-centered care. These principles will continue to support safe, effective, and evidence-informed practice in future clinical settings. Bibliography: Barrel J.P. and Messier P. 2005. Visceral Manipulation, Eastland Press, Sheila A.G., ed. 2011. Foundation of Osteopathic Medicine, 3rd edition. Lippincott, Williams and Wickens. Drake R.L. Vogue, A.W., and Mitchell A.W.M., 2023. Gray's Anatomy for Students, 5th edition. Sylvia, Kushira W.A. and Kushira M.L., 1994. Osteopathic Consideration in Systemic Dysfunction, 2nd edition. Grading Press. Mori K.L., Dali, A.F., and Ago, A.M.R., 2023. Clinical Oriented Anatomy, 9th edition. Walters Kluwer, Posaki P., and N.S.E., 2011. Osteopathy for musculoskeletal pain patients, a systemic review of randomized controlled trial. Clinical Rheumatology, 30, open bracket 2, close bracket, comma, 285-291. Scliffe, Arrow, Findley, T.W., Shito, L., and Hugin, P. A. eds. 2012. Fascia, the tensional network of the human body. Elsevier Stangrick, S. EAD. 2011. Gray's Anatomy, The Anatomic Basic of Clinical Practice, 42nd edition. Elsevier, Ward, Arrow E. ed. 2003. Foundation for Osteopathic Medicine, 2nd edition. Lippincott, Williams and Wickens, World Health Organization, 2023. World Health Organization Guideline for Non-Surgical Management of Chronic Primary Low Back Pain in Adults in Primary and Community Care Settings. World Health Organization. I'll be attaching this biography file to the video link. Thank you.